So thanks again for bearing with me one more time. Again, this is unexpected, but I do want to specifically thank Rahul Tendulkar for his support of this endeavor that we worked on together with a few other members of our staff and administrative crew. So in reading the lay press, it's easy to kind of notice these increasing numbers of articles saying that doctors have little or no management training, and that may be an issue. So this is one, obviously you can see an article from the Harvard Business Review. There were a couple others as well that had come out, one from Forbes and a separate one from the Harvard Business Review. And I had reviewed these articles and kind of looked at what pieces they had put together in terms of the support of propagating this to kind of, normal civilians around the United States. And a number of them pointed to the same social science article, which was a project done. It was actually published a while back, and it looked at the top 100 hospitals in the United States and looked specifically at their CEOs and followed them, kind of like traced their career history and educational history by hand to see what themes emerged in terms of why certain hospitals were maybe more effective than others. And so they, they kind of basically addressed the specific question that was proposed by that first Harvard Business Review publication I mentioned about why this minimal management training is a problem in the field of medicine. And so what these authors in this 2011 publication had shown is that of the 6,500 hospitals around the United States, only 235 are led by physicians. And when they look at this, the way that they kind of trace their career paths, they were able to specifically look at certain kind of high volume clinical specialties, so cancer on the left, digestion in the middle, and heart care on the right. And they use this metric, this mean index of hospital quality, which is apparently a validated metric to look at the score of hospital quality. And basically were able to determine that these hospitals that had a physician CEO, again seen in pink at the top, were consistently outperforming the hospitals that don't have physicians at the helm. So the Forbes article had gone into why they believe that physicians make good leaders. They talked about how the medical training really lends itself to allowing physicians to serve in this role. So remaining calm under duress, which we all have to do through both med school and residency. Secondarily, communicating with a wide variety of people in a wide variety of circumstances. Having to make decisions quickly, sometimes with limited information. Always multitasking, particularly in our field, I feel like we particularly do that. Having patience and taking the long view, which we definitely are good at with our many years of training, taking responsibility, and then exhibiting empathy and compassion. So I wanted to know, and alongside Dr. Tendulkar and Dr. Amanath and a few other people in my program, Danielle Barry, we wanted to look at how, is there leadership training that's offered in radiation oncology? So we did a very limited literature search. You can see at the top, this is very selective, but we got 4 hits when we combined this, and none of them were actually that relevant to the specific question. And so I wanted to assess out, kind of as a needs assessment, sort of trying to build this program alongside Dr. Tendulkar, what types of leadership training did we have our Cleveland Clinic residents amongst this group that maybe they had received at some point during their medical training. So we did this really short upfront survey asking residents, have they had any leadership training in the past? And as you can see here, the majority of them, 82%, said no. A couple of them had said yes, and we did have an open comment area and found out that the 2 people who'd had prior leadership training had it preceding any coursework in medicine. It was because of prior careers. So then we asked the residents as well, from your perspective, how important do you believe leadership training is in your future career as a physician? And as you can see here, basically those bottom 2 bar graphs there, over 90% felt it was important or very important to their future lives. So from this, we wanted to see if this was of interest, because we had thought and kind of brainstormed together as a group, maybe this is like some sort of programming we should offer to our residents, and potentially even sort of in a retreat type fashion. We wanted to make sure it was something that would be of interest and that actually there was a need, and it wasn't just us coming up with this out of thin air. So we did create actually a leadership training program at Cleveland Clinic just this past year. It was our inaugural year of this. This chart kind of maps out what we delineated for our group. You can see on the left two columns, there's sort of year one, part one, which would take over, it took about the course of an entire day. Residents were excused from clinic for this purpose. And the second part of it took a portion of a day for which residents were again excused. And so the first day is kind of looking at self and team awareness, and then secondarily looking at principles of effective communication. And then next year, we've already kind of mapped out how we'll do these next 2 days, again, kind of removed from clinic for these purposes, looking at cultural development, so understanding how to create a culture of engagement, and then physician wellness components to that as well, recruitment, mentorship, and then lastly, operational leadership, understanding how to make decisions and implement change in organizations. And the way that we've constructed this is intentionally to have it be repeated over the course of a 4-year residency training program, so that senior residents can kind of bring new perspectives to recurring themes and help serve as kind of short-term mentors to maybe their junior residents when we have these discussions. So we did map out sort of like day one agenda, again, trying to provide a blueprint for people who are interested. This is in press and the Red Journal, so it will be available soon enough. But how we had structured that first day is we sort of had our chairman provide his own leadership journey to all of us, where he was very reflective and very humble about all the lessons he'd learned. We did a values exercise where, again, using interactive methods, kind of having residents share their personal and professional priorities and help better understand their own priorities. We had a communication exercise where participants would divide into small groups and sort of define the roles of effective leaders and team members. Prior to the session, we had a strength finders exercise where participants could kind of distill their strengths by a pre-seminar survey and then share those strengths with the group. And again, kind of to serve as a way to reflect on their own strengths, but also to allow each other to learn more about one another when we function in this kind of team-based fashion. We had a group lunch and then sort of team building exercise. We mentioned a few here that could work. We did an escape room and then had a debriefing afterwards, which was really a good time for everyone. So this is, again, just kind of summarizing how things had gone that first day. We did read several chapters from this book in advance of the session, Leadership 2.0. There's a couple other books there's a lot of leadership books out there that are really good. Our chairman's a big proponent of Good to Great. There's Emotional Intelligence 2.0. There's a few others that are good that we included in the publication. Here's a few photos from our session. On the left, you'll see our chairman, John Sue. Top right, there's just a picture of us kind of in our interactive seminar type session. Again, we were kindly excused from our clinical duties for that portion of it. So we did an escape room, like I mentioned, and had a group lunch. And then I didn't have the slide on this, but we did a post-session survey and asked residents, did a fully anonymous survey, and asked them, did you find this valuable? Would you recommend it to fellow resident trainees among any specialty program? And 100% of them said yes to those questions. So in conclusion, I'll say that leadership training is increasingly valued in medicine. It's something that's talked about. Again, if it's reaching the lay press, it's particularly important for us to be aware of. And we think there are a number of keys to the success of our pilot program. Residents had dedicated time away from clinical duties, and our leadership supported that. We had experienced facilitators from both within and outside of our department. We had clear expectations and encouraged active participation. Interactive sessions were favored. Again, as I mentioned, the curriculum is designed to reinforce themes over a 2-year schedule, and we had team building components. So I do want to just, again, specifically acknowledge our leadership, Dr. Tendulkar and Dr. Sue, and our Associate Program Director, Sylvia Emmernath, and Daniel Berry, for their efforts in this program. And we feel fortunate that we can move forward and are granted the time to keep going. So thank you. I'll take any questions.